Hi everyone, I'm Julia.
Hi everyone, my name is Erin.
Last week I posted some videos starting to explore the correlation between persistent pain and familial dynamics.
Next week I'm going to be going into some more detail about the topic of kinesiophobia, which is the pain science topic that I'm going to be discussing on my own.
But for now, we wanted to come together and talk a little bit about how our two topics intersect.
Kinesiophobia is defined in the literature as an excessive, irrational, and debilitating fear of physical movement that is resulting from a feeling of vulnerability due to painful injury or re-injury. And this topic I'm going to be diving into a little bit more in the coming weeks, so stay tuned for more on that.
And as I mentioned in my previous video, we know that familial dynamics can have a strong impact on both the development and perpetuation of persistent pain. This relationship is well supported in the current literature, and that correlation can also be extended to when a family member is experiencing kinesiophobia.
Pain is a learned experience, and environmental factors can be a large contribution to the development of persistent pain.
In our daily lives, our family members can play a huge role in developing our contextual factors, which can help develop our understandings of things like pain as we grow up.
When we see our own family members demonstrating negative reactions to pain, it can normalize that response for us and can teach us to act similarly, even if we aren't aware of it.
Studies have found that offspring of parents with persistent pain tended to have more internalizing problems, such as anxiety and depression. So we can conclude that children who observe their parents experiencing persistent pain are also more likely to exhibit characteristic behaviors and thinking associated with kinesiophobia, which is simply anxiety about movement.
This impact that a parent has on their child's pain experience is known as social modeling, which describes a process in which individuals can learn by observing the behaviors and outcomes of others without having to directly experience it themselves. And this does not only just extend to parents, but it can extend to anybody who's socially influential in one's life, including other close family members or even friends.
An experimental study by Goodman and McGrath explored how this model can specifically be seen between children and their mothers.
The study showed that after having observed their mother's model exaggerated pain behaviors and expressions, children reported having lower pain thresholds. Similarly, after having observed their mother's model minimize pain experiences and expressions, children also showed less pain behavior on their faces as well.
A different study by Simmons from 2017 explored fear of pain with movement, or kinesiophobia, in children and adolescents experiencing neuropathic pain or chronic regional pain syndrome, CRPS. The authors found that there is emerging evidence which highlights the additive impact of parent variables, including both fear and avoidance, on the child's chronic pain experience. In other words, a parent's fear of movement can be passed on to their children through observation and learned understandings of pain.
A different study by Bezrek et al. In 2018 found that the level of physical activity in younger children depends on the child's relationship with their parents and the parents' level of activity. So regardless of pain, a child's relationship to movement is highly correlated to their parents' relationship with movement and the behavior that their parents model.
From all of these studies, we can extrapolate that a parent demonstrating behaviors of kinesiophobia can pass that on to their child, who only knows this learned experience of pain from the context in which they grew up.
So now that we understand that this relationship exists, what can we do about it? The current literature on kinesiophobia demonstrates that techniques from cognitive behavioral therapy, or CBT, can reduce fear avoidance behaviors and can increase participation in desired activities.
One method from CBT is known as cognitive restructuring. This term refers to the act of identifying ineffective patterns of thinking and changing them to be more effective. This is one strategy that someone can use to begin to change their relationship with pain and unlearn the kinesiophobia behaviors that were demonstrated by their family members.
For example, the thought, "my back always hurts when I bend over," can be reframed to "bending will not cause tissue damage to my back," or "my spine is a strong structure that can withstand different motions."
It is important for this relationship to be better understood by anyone who might be experiencing pain related to the environmental factors from their personal lives and family dynamics, because it can be addressed and those effects can be minimized. Often, as I discussed in my previous post, there is a gap in understandings of how family relationships can contribute to a chronic condition.
But by closing this gap, the road to recovery can become much smoother.
All of the research used to make this video will be linked below in the caption.
Comment below if you have any questions or if there's anything that you would like to learn more about. Thanks for watching!